Now, today we'll be talking about one of the excellent drug that is the extended spectrum penicillins. Among the penicillin, the one of the most common usually drug that is amoxicillin. We'll be talking about this amoxicillin because this is extensively, very commonly used almost for all the all the indications. You just name it, any disease, it can be used. That is the reason why we'll be talking about amoxicillin. Now, it is of amino penicillin group. That is, it is amino because there is an amino group substitution in the side chain of beta lactam. Now, we know that this amoxicillin is very commonly seen with, it is the content which is very commonly seen with clavum, tablet clavum, or sensiclav, or tablet duet, or augmentin. So there are so many brands which actually has this amoxicillin. Now, the oral absorption of this drug is excellent. That is the reason why this is one of the most favorable drug by all the general practitioners, all the MDs, and all the doctors or surgeons as well. The food doesn't interfere with the absorption of amoxicillin. That is the reason why you can give it at any point of time, before food, after food. It doesn't matter when you give it. You can give it that at any point of time. The incidence of diarrhea is much lesser when compared to ampicillin, but we know that diarrhea can be pretty common with amoxicillin. Maybe around 20 patients out of 100 patients they get diarrhea, but it is very easily manageable at most of the time. It has excellent tolerability, and it is very interesting drug because it affects, it damages, it kills so many gram positive as well as so many gram negative bacteria as well. It can kill E. coli, Proteus, Salmonella, Shigella. So in short, it can be used for UTI. It can be used for acute gastroenteritis. It is one of the excellent drug for H. pylori eradication. That is the reason why those patients who have recurrent gastritis, those patients who keep on taking Pan D, MSET, Omes D, Razo D, those patients who keep on taking pantoprazole, rabeprazole, omeprazole, a 14 days course of H. pylori kit can be given, which contains two antibiotics. Of one is amoxicillin, and it can markedly reduce the gastritis episodes, or it can markedly reduce the number of pantoprazole, omeprazole needed to reduce the acidity. It is one of the excellent drug for Streptococcus, Enterococcus, Listeria as well. It is one of the excellent drug for pneumococcus as well. That is the reason why it is very commonly used for pneumonias. It is very commonly used for bronchitis, LRTI. So this drug is used for what? What are the indications of amoxicillin? You just name it, it can be used almost in all the infections anywhere in the body. It is used for bronchitis, lower respiratory tract infection, COPD, acute exacerbation, asthma exacerbation, which are infective. It can be very commonly used for tonsillitis or secondary bacterial upper respiratory tract infection. It is one of the excellent drug for urinary tract infection. It is one of the excellent drug for subacute bacterial endocarditis. As I told, this is used to eradicate the H. pylori, and the drug dosage has to be for 14 days. It has good soft tissue penetration. That is the reason why it can be used for diabetic foot, burn wounds. It can be used for any road traffic accident injuries, cellulitis. It is one of the excellent drug for soft tissue infections as well, as that is the reason why it is very commonly preferred by surgeons, general surgeons, as well as orthopedic surgeon as well. It can be used for diabetic foot because the uh, soft tissue penetration is very good. The amoxicillin goes through liver, so it attains high concentration in gallbladder. That is the reason why it is used for cholecystitis, um, for abdominal surgeries, for hernia surgeries, for joint surgeries. It is one of the excellent drug. It is very commonly implicated for typhoid. It is one of the excellent drug to treat the enteric fever or typhoid fever, otitis media, bacillary dysentery. It can be definitely used for sepsis of any bacterial origin, can be 100% used. So you just name it, any system in the body, it can be 100% used. It is one of the excellent drug. It comes in tablet form as well as injectable form. If you separate amoxicillin, it comes into the 500 milligram capsule, and it comes into tablet with clavulanic, and it comes into 625 milligram tablet form. It is very commonly used 3 times a day, but so many doctors use it twice a day also. Twice a day also is very much excellent, but most of the time it has to be used 8 hourly. So 625 milligram 3 times a day or 500 milligram 3 times a day is almost used for all the indications, may it be bronchitis, UTI, H. pylori, soft tissue infections, diabetic foot, joint surgery, or otitis, typhoid, you name it. Most of the time, it is used 3 times a day, 625 milligram thrice a day. Whenever a patient is admitted in the hospital, 1.2 gram is the usual dose that is given twice a day or thrice a day for around 5 to 7 days. Most of the time, this antibiotic dosage duration is around 5 to 7 days, which almost cures almost all the infections. For diabetic foot or for cholecystitis, for SABE, the duration of the medicine can be of longer duration for maybe 10 to 14 days. So it is one of the excellent drug, and it has very good coverage, covering both gram positive and gram negative.